Hello everybody and welcome to our second episode of ParkImpulse. In the upcoming episodes, we will be exploring the mind, mood, movement, and motivation. My name is Bettina Rodsetter and I'm joined with the neurologist, Dr. Ines Debove. Exploratory behavior. What does that mean? And what can bipolar disorder teach us about the brain's drive for stimulation? And how does the dopamine, the brain's reward chemical, blur the line between mood and movement? In the upcoming episodes, we're going to be joined by Professor Redfield Jamison, a clinical psychologist and renowned expert on bipolar disorder, and of course my colleague, Dr. Ines Debove, the neurologist, as they explore the surprising parallels between mood disorder and impulsive control disorder in Parkinson's disease.
So these patients didn't exhibit forcefully maniac behavior before putting
But
them on
they exhibited exploratory behavior.
Yeah, exactly.
That is actually related to manic behavior.
Okay.
Yeah.
So when you hear all these things, what I told you about this mood swings, and when you hear what the people are exhibiting in their kind of mood swings, where do you see the parallelisms in between bipolar disease and this patient's population? What would you...
Well, it sounds to me like the jury is out on heredity, bipolar illness and depression, severe depression. So these people didn't have any personal history.
No.
Of depression.
I mean, it can be that 10 years before the motor symptoms started, they had as a sign of Parkinson's disease that it was starting depressive behavior, or they had a depression before because it was a loss of dopamine, which led to this depression state. But I think then when you go back to the history taking of childhood or adult, we don't get that often.
And how systematic? I'm just curious for myself. I'm glad to shut up. But how systematic is the history taking of mood disorders in Parkinson's patients? I mean, do doctors who treat Parkinson's and study Parkinson's actually go back and do a thorough psychiatric history?
I don't know if it is a thorough psychiatric history, but we need to ask, or what we ask them when the patient is coming into our clinic, we ask them, did you have any suicidal ideations in the past? Did you have any depression in the past? Did you take any psychiatric medication in the past, antipsychotic medications? Because we know, of course, you can get from that also Parkinsonism. We ask them about also how was your childhood, normal development.
So from impulsive to compulsive behaviors, which are triggered by dopaminergic therapies in PD, we're going to keep discussing how exploratory behavior, risk-taking, novelty-seeking, and reward sensitivity can manifest across both psychiatric and neurological conditions. Thank you for joining us. We do hope you'll join us next week to continue these valuable conversations that bridge the disciplines and shed the light on the deeper currents driving human behavior. Stay tuned and stay connected, and most of all, stay curious.